Hi, Krista. My name's Jason Hood. I'm a physician assistant working with U.S. Customs and Border Protection. I understand that you were apprehended at the border today on a USCIS warrant. Okay. How are you feeling right now? Okay. And did you sustain an arm injury while you were coming across or during the arrest? An altercation in Mexico? Okay. Yvonne was telling me that you have a history of depression and anxiety. Okay, can you tell me a little bit more about that? Specifically when you were diagnosed, and how you've been treated, and how well controlled your symptoms are? And you were treated with Paxil? Are you currently taking the Paxil? Okay. And you have the medication with you? Okay, I'll talk with the customs agent and see if we can make sure that that travels with you in your personal property. Okay, how are you feeling right now? I know it's a stressful situation. Okay. Okay, how many children do you have? And they're currently with their mother. Okay. All right. So you mentioned in the past that you had taken Paxil for both your depression and your anxiety. Oh, and Xanax for your anxiety, as needed. Okay. How often were you having to take them? Okay. And do you have the Xanax with you, or just your Paxil? Okay. All right. Have you taken anything other than Xanax? Clonazepam? Was the clonazepam effective? Okay. All right. So what I want you to do, if you don't mind, and I appreciate you sharing with me, what I want you to do is kind of tell me a little bit about your anxiety that you have right now. And do you feel like you're having, is it pain in your chest from being arrested, from the altercation, or do you feel like this is something different? So like a more of a deep, okay. And have you tried any breathing techniques or relaxation techniques? And were those effective? Okay, good. All right. So I know that you're going to be transferred over to Webb County. Uh, the arresting officer, they let us know that you do have a warrant out there, so I just want to let you know up front that I'm going to be seeing you this time, but I will do a complete encounter and pass that forward with the customs agents as they transfer you, and then you'll be able to get care there. I've actually worked with the Webb County medical section before, and they're very good. So the PA that's working there now is very, very good. So just talk with them once you get on ground there, so we can make sure that we get your Paxil on board and everything is good. If you start feeling like you're having more anxiety, if it's starting to get worse, you feel like you're going to have a full-blown panic attack, you do have access to care there. Okay. So tell me a little bit about what brought on this anxiety attack. I understand that. Yeah, absolutely. I agree with you. I think it's probably situational. Okay. All right. Thank you for sharing that. I appreciate that. with the issues that you were having with your wife before you left to go to Mexico, did you feel like you had any closure as you were leaving, or did you feel like you left something open there? Okay, and did you have a chance to give her a call while you were down in Mexico? Okay. All right. And have you had a chance to talk to her since you were placed in custody? No? Okay. All right. And with the altercation, I know sometimes, emotions can run high and tempers can flare a little bit. Do you feel like you want to hurt yourself or anyone else right now? Okay. All right. And I'm just taking some notes here just so I can make sure I give you a comprehensive record. Here at Customs and Border Protection, we do handwritten notes, so if you see me looking down, that's the reason. Okay. And you have no cardiac history, no respiratory history, haven't recently been exposed to anyone with COVID? Okay, that's good. So as you were coming across, you were with a large group of people, and you were arrested on suspicion of trafficking. So can you let me know a little bit about why, kind of what brought you into that? So money. Okay. Has this been something you've been involved with before, or any kind of criminal activity like that? So you have a criminal record? Okay. And it's all been centered around your need to earn money? Right. Yeah, I understand that. The economic situation is really tough right now. I trust me, I understand. I don't cast any judgment on you for the decisions that you've made. I just want to make sure you're getting the most appropriate care. Right. And in that altercation, can you tell me a little bit about what led up to that? And do you have a history of losing your temper that way? And what do you do to try to de-escalate? Do you have any techniques that you use as far as trying to get yourself calmed down once you start to see red? Okay. All right. And then after that happened, you immediately moved towards the border. They picked you up there, and then they brought you in to see us, and you've been treated appropriately since then, from what you're saying. So that's good to know. Well, moving forward, what are your biggest concerns? Of course, yeah, that's understandable. She's going to be in a tough financial situation without your income. I understand that as well. Okay. All right. Well, with the anxiety that you're feeling right now, what I want you to do is we're going to go through a couple of guided breathing techniques. This is something that I've done with some of our other folks who have transited our clinic here, and we're limited in our ability to provide certain types of medications for you. Obviously, we can't have you in an intoxicated state as we move you forward. So what I'm going to do is I just want you to take a deep breath in, hold it as soon as you get your lungs full, and then I want you to go ahead and slowly release that through your nose. Okay, perfect. And with your hands, I notice that you're making fists. What I want you to do is go ahead and just kind of place your hands down so you can get to a relaxed position. Good. And understand that you're in a safe environment here. As long as you're in our medical clinic, we have oversight. So, I'll do a comprehensive examination, do a head-to-toe physical examination on you, and make sure that we don't hear anything in your heart or your lungs. But for now, I just really want to get your heart rate down and kind of get you into a calm situation. So let's take another deep breath. And we're going to hold it for a count of 5. And then slowly breathe out through your nose. Okay. Okay, good. All right. We're going to proceed to doing our comprehensive physical examination. Is there anything else you would like to discuss? The depression? Okay, tell me a little bit about your depression. It was diagnosed as a child as well? Okay. And the treatment with the Paxil seemed to be effective throughout junior high, early into high school. Okay. And then you stopped taking the medications when you were in high school. And that's when you got into some legal trouble. Okay. You did have a suicide attempt? Okay. And tell me a little bit more about what led you to try to hurt yourself. And you're not feeling those feelings now? Okay, that's good. Well, let me ask you this. If you did start to feel like you wanted to hurt yourself, is there any kind of protective factor that you have? Anything that you could use to help you get yourself out of that mind state? Okay. So your wife, your children, your mother, your desire to live, okay. And your desire to do better as a person, okay. That's good. I think those are all really good protective factors, and I applaud you for your desire to grow and learn from your mistakes. I think that's very mature of you. I think that's the first step in kind of moving forward. And have you recently made any kind of plan to hurt yourself? Have you had any suicidal thoughts or thoughts of killing yourself prior to coming in here to see us? No? Okay. And how's your sleep been? Okay. It's understandable. Have you been eating? Okay. So you haven't been eating as much, just feeling kind of tired, laying around. Okay. Well, those can all be symptoms associated with a depressive episode. Not wanting to get up, get around, sleeping too little, sleeping too much, not eating enough or eating too much. So what I want to do is I want to get you back, make sure that we've got you back on the Paxil so that we can keep that medication going. And we're going to get you over to see the folks as soon as we get you in processed over at Webb County. And then I think we can go from there. Okay, great. We'll move forward with the physical exam. Hi, Dr. King. I apologize for not being able to do this with the staff there at the Customs and Border Protection Clinic. We were going to try to move out to the parking lot to do it. Unfortunately, it's a secured area, so as we moved out to our vehicles to try to do it, they told us that we weren't able to take pictures or film. So what I did is I went through the process. This is actually based on a patient that we had come through. I went through the process of sitting down with one of my medical technicians. We did the one-on-one. Our CNA actually sat and watched us, and then I got some feedback from both. The biggest things that they told me was to watch my facial expressions. Apparently, I have a very expressive face whenever I'm talking to patients. I tend to raise my eyebrows quite a bit, which I guess you can probably see in the videos. And then I talk with my hands quite often. The other thing that my CNA noticed was that I tended to look down and write a lot more than she thought was kind of really appropriate. I didn't notice that. Unfortunately, here we do the paper copies of all of our medical records, so I think it's kind of a necessity for me to be able to keep up. I appreciate you letting me turn this in late. Once again, I apologize for not getting that submitted whenever I initially tried to put it through. But please let me know if you have any questions, and thanks again.